Okay, welcome everybody, and thank you for joining me today. So I'm really looking forward to talking about ADHD. Um, so before we get going, a little just note on Wellness Within and who we are. So Wellness Within is a team of compassionate mental health therapists dedicated to providing exceptional mental health and wellness services to individuals, couples, and families. The why behind the monthly wellness webinars. So mental health resources are more accessible than they've ever have been, which is both a benefit and a challenge. So our goal with the wellness webinars is to ensure our community has accessible evidence-based strategies that they can trust. So our team, we have a beautiful team here at Wellness Within. So we have Kyla, who is a registered social worker and the clinic owner. We have Samantha, who is a registered psychotherapist. Ashley, who is a registered psychotherapist. We have Amanda, who is a registered social worker. Darcy, who's a registered psychotherapist. Sarah, who's a nurse psychotherapist. And Megan, who's a registered psychotherapist. And then we have the students. So we are registered psychotherapists qualifying, and we have Brittany, Kelsey, and then myself. Okay, so today we're talking about ADHD, and I just wanted to give a general breakdown of what we're going to go over. So we're going to go over a bit about the background, what ADHD is, what ADHD looks like, specifically what it looks like across different developmental stages, the process of diagnosing ADHD, treatment, and then we're going to finish off with some tips and tricks. One note that I just wanted to say before getting started here is that this is purely informational and not necessarily a way to diagnose. Okay, so what is ADHD? ADHD is a neurodevelopmental disorder characterized by hyperactive and inattentive symptoms. In general, there's 3 different presentations of ADHD. Sometimes they're referred to 3 different types of ADHD. And these are known as hyperactive impulsive, inattentive, and combined. So the combined presentation is the most common, followed by inattentive and then hyperactive impulsive. Hyperactive impulsive is more so seen within children, and then inattentive is most common in youth and adolescents, as well as in women. Hyperactive is a little bit more common in men. And then combined, it's just more common in general. Okay. So what does ADHD look like? The ADHD brain. So let's just first start about talking about what neurodevelopmental means. So neurodevelopmental refers to how the brain grows and how it develops, how it builds and organizes itself, and how it works in everyday life. So this difference of brain development results in a difference in connectivity in certain areas and functions of the brain. So essentially, the brain, we are very active in some areas and less active in other areas. And this difference of brain function or brain development leads to hyperactivity and differences in executive functioning. I've just bolded here the 3 key features here, which is hyperactivity, attention, and impulsivity. But all these other characteristics are also seen within ADHD. So working memory, processing speed, flexibility, ability to regulate emotion. Another key note that I wanted to elaborate was the attention piece. So attention is often considered like someone isn't able to focus if someone's experiencing ADHD. But it's not necessarily that you're not able to focus or you're not able to have attention, is that you're having difficulty regulating that attention. So similar to emotion regulation, it's not that there's difficulty feeling or having emotions, it's difficulty regulating those emotions, if that makes sense. Okay. Another quick note I wanted to go off of was differences in sensory processing, because that's also not as discussed as much in ADHD. I don't dive deep into it, but I did want to make a quick note on it. In general, sensory processing, so for example, our sensitivity to sounds and light is more so grouped in with ASD, so autism spectrum disorder, but that's also a feature that's takes place within ADHD as well. Okay, so what does ADHD look like? It's extremely variable. One of the reasons why it's difficult to study and it's difficult to diagnose. Um, how ADHD manifests and presents may differ depending on the unique individual and is influenced by age, sex, gender, and the environment. So, for example, an adult having difficulty with attention might react differently than a child having difficulty with attention. Similarly, if we're in an environment which fosters a sense of safety and support, then there may be more of an opportunity to explore skills to improve attention or strategies to help regulate emotion. So even though you may have two individuals who have similar activity in the brain or similar differences of activity in the brain, how it manifests can vary depending on, I mean, depending on essentially everything. And that's also why being able to figure out, oh, is ADHD the issue or something else the issue, becomes very difficult. So I've divided it up here. We're going to take a look at how ADHD presents in children and then teens and then adults. And then I categorize it mainly into three categories. So hyperactivity and impulsivity, inattention, and emotion regulation. This is very generalized. I just want to make a note of that. So in children, hyperactivity and impulsivity is more common, as well as inattention. Hyperactivity and impulsivity is more common in young boys, whereas inattention is more common in young girls. Examples of hyperactivity, impulsivity include fidgeting and squirming, always on the go or talking excessively, interrupting others or not waiting their turn, running from toy to toy, displaying impatience with others. Inattention. So another way to refer to inattention is difficulties regulating attention. And this might look like making careless mistakes or not finishing tasks, not well organized, or loses belongings. Loses belongings. This is a key theme across all stages of development. And an interesting note on this is that memory is a really key factor here. So if there's difficulties regulating our attention, then we might be having a conversation with someone, but thinking about, okay, what am I going to have for dinner? Or thinking about, what's that clock ticking in the background? So those are all examples where our attention might be shifted onto something else. So we're not present in the immediate moment, which means what's happening around us, how it's being formed into memories isn't as effective. So losing our belongings is very common. And then emotion regulation. So more unexpected tantrums, becoming easily frustrated, or being prone to outbursts. Okay, so shifting to teens. In general, inattention is seen more in teens. And in part because as we move through these stages of development, we become a little bit more self-aware and more influenced by social norms. So for example, sitting in a seat and not being able to sit still, it might evolve into just feeling generally very, very restless. So these core features in ADHD, difficulties with attention, planning, emotion regulation, they'll manifest differently depending on different stages of development, as well as social and cultural norms, family dynamics, and additional experiences. I'm not going to read off all of these just for the purpose of repetition, but I'm going to elaborate here a little bit. So for instance, individuals who have experiences of trauma, for example, specifically within childhood or early adolescence, that might have additional challenges with memory, focus, and emotion regulation. And this intersection of ADHD and trauma, that might present differently than the presentation of ADHD alone or trauma alone. So that's where the variability comes in, and that begins a little bit in teenagehood, is how ADHD symptoms are expressed differs, and external experiences play a big role in this. Similarly, using the example of anxiety, let's say we're in high school, and anxiety is a really big struggle of a young student. Then going in to take a test, they're going to experience all the physical sensations that come along with anxiety, in addition to feeling distracted by what's going on around in the classroom, not being able to focus on a specific question, hyper focusing on a specific question. And then those anxiety symptoms in conjunction with those features seen in ADHD, that results in a whole other experience, which is another reason why how ADHD is presented differs a lot across different individuals. So going off of that note, difficulties with regulating your attention, emotion, not being able to put your homework in on time, having difficulties sitting down in the classroom, having difficulties processing information. That can all lead to difficulties with self-esteem, lack of confidence, and self-doubt. And then as we move through the stages of development, self-doubt and lack of confidence can then mold into things like anxiety and depression, and such. So it becomes a little bit more complex as we move through stages of development here. So I want to take a moment just to look at some differences between women and men with how ADHD symptoms are experienced. So women are more likely to experience inattention, and they experience different challenges in emotion regulation due to ADHD symptoms varying with hormonal changes, such as those that occur during menstruation, pregnancy, and menopause. Women also have a stronger tendency to internalize symptoms and a higher tendency to mask symptoms. So there's a combination here of both biological factors as well as social factors. For example, hormonal changes refers to biological factors, but then stronger tendency to internalize symptoms and higher tendency to mask symptoms, that could be linked into social factors because there's social norms about how women and men are expected to behave or expected to present themselves in society. Okay, and then looking at from the opposite spectrum, we have men are more likely to express aggressive or antisocial behavior, more commonly associated with substance use, and more likely to experience hyperactive or impulsive symptoms. Again, I want to stress so much that this is a generalization across research. So typically, men externalize symptoms while women internalize symptoms. And this is also why ADHD tends to be diagnosed more in young boys, because it's much easier to see someone in a destructive classroom or cause issues between classmates or not being able to sit still than someone sitting in the chair and just kind of looks like they're zoning off a bit. With men as well, since ADHD manifests in more disruptive or external behaviors, the psychological element tends to be more overlooked. So things like self-esteem, confidence, emotion regulation, planning, those additional executive functioning skills, they might be overlooked in men. Because maybe the focus is going to be on substance use. Maybe the focus is going to be on managing impulsive behavior, when there's also additional experiences that accompany those outward behaviors. Okay. So adults. So again, I'm not going to read off of all of these because I sound a little bit like a broken record here. But essentially, it's very similar features manifested differently. So if you have someone in a student in high school, that they might be struggling to put in an assignment on time. Whereas as an adult, you might be struggling to manage projects, to navigate family commitments, will also navigating job obligations. And it's experienced differently because of different stages of development and different expectations within that age group. Another interesting note that I wanted to say here is that while researching ADHD, if you look at, for example, what does ADHD look like in adults, it's very, very vague. It can say, possible symptoms in adults, or symptoms in adults could look like this. And the reason why they use that type of terminology is because it's highly variable, in part because there's more unknowns. So I'm going to generalize here, but if a parent is bringing in an 8-year-old child in for difficulties with focus, it would be safe to say that, all right, my child does not have a full-time job, has not experienced substantial external pressures, eats sufficiently, has not experienced the social pressures of high school, and does not frequently consume illicit drugs, and the list goes on. As an adult, we can't necessarily say the same. So trying to figure out the challenges with focus is a result of ADHD or another cause can be a little bit difficult. The next question is, why might someone why might an adult experience ADHD symptoms as an adult and not as a child? And essentially, the easy answer to that one is that it's just a little bit more difficult sometimes to be an adult, and it's a lot more demanding. So there's additional responsibilities, there's workplace pressures, there's challenges with job performance, there's family obligations, financial stress, relationships, societal expectations, and the list can go on. So in other words, it's just much more demanding. So you're asking your brain to do a lot more than you were asking your brain to do when you were 10 years old. Yeah, okay.
Sarah, I'm just going to jump in for a sec there and also to say, like, our brain and our body and just our environments are constantly interacting with one another too, right? So, like, our brain is changing based on the environments that we're in, based on the way that our body is feeling. Like, if we've had any like chronic illness or any sicknesses or anything like that has changed it. Like, everything is constantly kind of working with one another. So it can also make sense that like our biological parts are changing as we are getting older, and those job responsibilities and pressures and everything else, like the stress is impacting it. It's always interacting. So just wanted to kind of like strengthen that point for you.
Absolutely. Thanks, thank you, Kyla. So moving on to the diagnostic process. It's a process, which has been a common theme in this presentation. So there's no single test to diagnose ADHD. You can't just kind of put your brain in a scanner and say, oh, yep, ADHD brain. And many additional concerns such as anxiety, trauma, depression, sleep problems, and certain types of learning disabilities, it can all have similar symptoms, which just creates the diagnostic process that much more complex. In children, the diagnostic process usually involves a checklist for rating ADHD symptoms, taking a history of the child, usually from the parents and teachers, but sometimes from the child themselves as well. And then more thorough assessments might involve engaging in a series of tasks. And most of these tasks target executive functioning. So attention, planning, and so on. Adults, it likely involves reflection on childhood experiences. In some cases, old report cards might be requested. Assessments might vary. A key thing here is that since it is a neurodevelopmental disorder, to have the diagnosis, it has to be present as a child as well. So even though the symptoms might come to light more so when you're an adult, doesn't necessarily mean they didn't exist when you were a child. So that creates the diagnosing process more complex if, for example, you don't have access to report cards and things like that. So there might be more interview type assessments instead. So if ADHD is a concern of yours, then seek guidance from your family physician, professional in the field, walking clinics or family doctors. That's kind of the first line of action for that. So why diagnosis can be helpful? Diagnoses help guide treatment. So for example, if you're struggling with both anxiety and ADHD, kind of exploring which one is more prominent will definitely influence the course of treatment, specifically in respect to medication. Diagnosis can also help provide a sense of community. It's also very helpful in exploring academic accommodations. And then diagnosis can also contribute to self-understanding. So giving insight on how your brain works the way it works, and strategies that we can use to help address that. Things to be mindful of. I touched a little bit on that in the previous slide, but as an adult, diagnosis can sometimes be challenging. So part of the DSM-5 criteria, which is what we use to diagnose ADHD, includes symptoms onset before 12 years of age, symptoms that cause impairments of living. So for example, if there's difficulties with impulse control or focus, it has to be in some way interfering with your day-to-day life. And the manifestation of symptoms should not be better explained by other conditions. So for example, lack of focus, motivation, difficulties with sleep, that can be associated with a lot of different disorders, such as anxiety, PTSD, different mood disorders, and the list kind of goes on. And the key reason that they want to differentiate between different disorders is just to help guide treatment and to make sure that what you're struggling with is being treated appropriately.
So I'm just gonna ask Sarah, would you say like if anyone in this call has looked at the checklist that you've listed a whole bunch of the symptoms for each one and they're like, yep, that's me, that's me, that's me, that's me, that's me. Like, would you suggest just like reaching out to family doctor then and inquiring, like even if maybe they don't meet those criteria when the doctor actually goes through the process, but just to get that started, like when in doubt, always reach out kind of idea?
Absolutely. When in doubt, always reach out. I love that. And that's a great first step. And again, since a lot of this is a generalization and it's so variable between individuals, if there's even some that resonate with you more than others, then that can indicate a reason to kind of explore a little bit further, and get some more professional guidance in that territory.
Because I like all the symptoms that were listed can be something that we can cope with sometimes, but we just need that help along the way. And they're sometimes impacting our ability to like stay focused or reach the success or wellness goals that we want. So anything that's like limiting us or enabling us from reaching our goals, I think is something to navigate with a support team. So whether it is ADHD or it ends up being anxiety or anything else kind of surfacing for us, I think if it's impacting our day-to-day, that's something to reach out and get that support. As therapists, we can't do that diagnosis, but we would be happily able to support you in that symptom. So any symptoms that you come up, even without that label of ADHD, but if that's something you're suspecting, like us as a therapist team, we can work with you on those symptoms to kind of help shift things happening in your environment. Obviously, we can't control like the medication component of things, but the other things we can treat just based on the symptom exploration opposed to even a diagnosis, because diagnoses are hard to get sometimes, right? So
yeah. And at the same time, going off of what Kyla was saying there, is that I think it's easy to say that, okay, this isn't causing huge impairment to my everyday living, which means I don't necessarily need to do something about it. That's not necessarily the case. Like even if you're able to go do your job, even if you're able to, get straight A's in school, but you still struggle with processing information. You're still struggling with that focus factor. You're still struggling, with some impulse control, and just seeking that immediate gratification. If that's still present, but you're able to manage, doesn't necessarily mean it's not present. And different strategies can absolutely help with that. So I just wanted to make a note of that, because you don't have to be over the line to still seek some guidance.
And Sarah Rice actually posted in our chat too another link. If you don't have a family doctor, which we know, especially in the Kingston area, is a challenge for many, there is a link in the chat, mycompasshealth.ca, that she's had positive feedback from that can help with some assessments. So, and I've also heard telehealth as well. So, but I won't overtake anymore, Sarah.
No,
Take the
no,
lead.
it's okay. We're doing well with time. I really sped through those first little bit, so all right. So treatment. So ADHD is usually treated using a combined approach. So this combined approach might include skills coaching, therapy, support groups, medication. I'm not going to dive too much into medication just because that's not my area of expertise. But I just will make a note that there is a lot of different medication out there, and if one's not working right, be patient and explore different ones. Skills coaching therapy. Sometimes these two can be combined. Skills coaching is more so catered towards practical skills that can be used to help account for difficulties with planning and managing certain behaviors. And then that really goes hand in hand with psychological and behavioral therapy. So psychological is focusing more on emotions, feelings, thoughts, or our minds, whereas behavioral is our behaviors. And most often it's a combination of two. So there's lots of communication between our behaviors and our psychological dimensions of ourselves. So in therapy, we'll most likely explore both avenues. Okay. Another thing that I wanted to make note of, this is personally an area that I'm really passionate about, is looking at it through the lens of brain health. And one of the reasons why I really enjoy looking at it through this perspective is because this is something that we have control of. We can absolutely change our eating habits, our sleeping, and exercise. So exercise, for instance, it increases the production of dopamine and norepinephrine, which are neurotransmitters that help with focus, attention, and mood regulation. So people with ADHD, they tend to have lower levels of dopamine in their brain, and exercise essentially like increases these levels and invites activation to those regions of the brain that might not be as activated. Exercise also increases blood flow and activity in parts of the brain that are related to attention and behavior. I like to compare it to essentially we're going into a manual gear. So instead of allowing our brain to automatically do its stuff, we're just taking the reins a little bit and giving it a bit of a head start. So tending to what we're eating, tending to our sleeping, and tending to our exercise are really great tools just to help give us a good foundation of learning new skills and exploring issues that could be for further in therapy, for example. But tending to these three basic needs are absolutely a great way to begin. Sleep, actually, so Kelsey's doing a webinar on sleep in our next month. So if you want to learn more about sleep hygiene, absolutely take a look at that. Okay, tips and tricks. So before I get into tips and tricks, I just wanted to invite everyone to the floor. If there's any tips and tricks that anyone has experienced to be helpful with managing features of ADHD.
I know like time chunking, and
Mm-hmm.
that can be really helpful for some of the people in my life that have ADHD, just to say like this is from this time to this time I'm going to do this. Like every minute is kind of chunked to some extent. And then also timers. I know my
Mm.
son and I use those quite a bit, and maybe that's a toddler thing, I'm not sure, but I do suspect that there might be some ADHD forming for him upcoming. But yeah, we use timers. So he seems to be very like on cue if we use the timer, and it's a visual timer. So we got it on Amazon. I would love to support local, but unfortunately, Amazon was much more convenient at that time.
Mm-hmm.
And it is a little almost like those old kitchen timers that you would crank and make, but it has a rainbow. And so that rainbow, you watch it, and as it goes away, you know your time's coming up. So that seems to have worked really well for us.
Hmm. Yeah, that's great. Thanks, Kyla.
I love the idea of music. So I've had clients who will have a playlist that sorry, I'm in the background, but they have a playlist of maybe three of their favorite songs. And if they're procrastinating or don't have motivation, they just put that playlist on and do as much as they can during those three songs. And I have a client who loves Taylor Swift. So she puts on the 10-minute version of All Too Well and does what she can just in that song. So adding something you enjoy to it.
That's such a great idea. I love that. I haven't heard of that before. Okay. Any other tips and tricks before I give a little bit of a list here?
I'll just jump in with one that I find helpful for myself um, with ADHD is I obviously this can't be used like all the time. It would depend, but trying to have everything prepped as much as you can in advance for things. So like every evening, I have, everything set out, everything ready, so I'm less likely to forget or rush out the door with things that I need. So like my bag is all ready, even to the point where I don't as much now, but I would have like all days of the week my clothing laid out for 5 days in advance, all the way through. So just all of those things are already ready for me, and I can kind of just grab and go.
That's a great one. Absolutely. And I think I actually include that in this list I have here. So that's awesome. Okay. So quite a few and more. So exercise, healthy eating, and sleep. I touched upon that a little bit in the previous slide. Um, Reducing distracting stimuli. So this can be very helpful. For example, if you know you need to get a project done, is finding a quiet space with not a lot of distractions. You see a lot of children have those noise canceling headphones, which are absolutely wonderful. There is no shame in using these as an adult. They can be used at any age. And they just really help take out any kind of distracting stimuli in the background. Recognizing strengths. I really like this one. I was looking at an article written by a psychiatrist who looked at ADHD through the lens of like an evolutionary lens. And what they were saying essentially was we need all these ADHD brains to help gather food, to help have creative new ways to solve problems. Um, to be on the go and essentially problem solvers because creativity is very much associated with ADHD. Um, so looking at it through that lens brings a bit of a different perspective. So the same thing can be looked at with focus. There's a lot of emphasis on not having the ability to focus. At the same time, when there are things, specifically things that are very stimulating and engaging, um, individuals with ADHD can experience something called hyperfocus. And you experience in focus in really long periods and have difficulty actually shifting from one task to another task, and you're staying on that one task for a period of time, which can be extremely productive in some cases. On the opposite spectrum, can be unproductive in other cases, depending on the importance of the task. So recognizing strengths and working with that. Time management skills. So creating schedules is a really, really good one for this. Timers, like Kyla said, setting timers. Not using phones as timers because there's lots of distractions on the phones. There's like agenda books that have outlines of the day, which can be very helpful. But anything that can help manage what you're doing during specific chunks of time to help direct you. Creating reward systems. So I briefly talk a little bit just about difficulty with regulating your reward system and wanting a bit of that immediate gratification. So we can use that to a strength. So for example, pairing 20 minutes of work with, a muffin or a 2-minute break of looking at the phone or a favorite song or things that excite you. And that's just almost manipulating yourself to a way, but in a positive way. I don't like the word manipulate, but you're setting yourself up for success. Small interval focusing. This is very, very popular. So essentially doing 20 minutes off, 5 minutes off, 20 minutes on, 5 minutes off. You can play around with those segments for whatever works best for you. Instead of trying to say, okay, I'm going to work from 9 until 5. That's a long time. Instead, you mean like, okay, I'm going to work from 9 until 9:45 doing this task, or 9 till 9:30 doing this task. And I'm going to switch at 9:30 to 10 o'clock. I'm going to do this task. And somewhere there, I'm going to have a break. For kids, we often use the terminology a brain break. So giving our brains a bit of a break. If that means, playing a little bit of a card game, exercising our cognitive skills in a bit of a different way than what we were just doing. So adding some diversity to a given task. Mindfulness exercises. This helps bring us to the here and now. It helps with the memory element as well. So if there's lots of difficulty remembering certain events, tasks, forgetting keys, forgetting wallets, things like that, practicing mindfulness exercises can help just encourage us to stay in the present moment. This can be deep breathing. This can be going for a run. This can be going for a walk. This can be journaling, mindful creative work. It can be very flexible, but the goal from mindfulness exercise is to bring us into our bodies and into the here and now, and can help, for example, if we're in a conversation and we're speaking, we're not thinking about what we're having for dinner, which brings us out of that present moment. That's really hard. I'm saying it like it's really, really easy, but it's not easy. And it takes lots of work.
I've also heard, Sarah, that sometimes you can actually just say it out loud, right? Like you can even just say like, I am putting my keys in my pocket. And so that like process of saying it out loud is being mindful, but it's also like, sometimes we get into that autopilot and it's bringing you into that present moment. So
absolutely. Absolutely. And routines is a really big thing for this as well. So for example, I have like a little bowl right by my kitchen that I put my keys in my wallet in every single day. It took a long time for me to keep on doing that. But then, okay, my keys, my wallet, they go in this bowl. Before I go to work, I'm going to my bowl, whatever's in my bowl, I'm bringing to work. So small things like that. Balance. The main note I want to talk about with balance is just to set yourself up for success. So stimulating your brain in different ways, eating well, sleeping well, finding time for self-care, all contributes to just being able to have a healthy functioning mind at the same time. And then finally, self-compassion. I really like to emphasize this. It's really easy to get down on ourselves and to get frustrated with difficulties with focus or difficulties with remembering, or being like, oh, I know I have to start this project. I just can't get myself to start this project. It's really easy to get down on ourselves for that. So just being kind to ourselves, and exploring ways to work with yourself instead of working against yourself. Okay, I think we're coming to an end here. I have a list of resources, so this is being recorded, so feel free to take a look afterwards at some websites and some books on ADHD. If you're interested in the research world, I've also included some resources here that have some studies surrounding ADHD.
And if anybody wants this stuff afterwards, please let me know, and I can always send it over as well. Just respond to the wellness with an email.
Absolutely. And then finally, if any of this has resonated, or you're looking to explore this a little bit further, we have a wonderful team here at Wellness Within, so feel free to reach out, explore consults, and go from there. So yeah, I think that's all I have on my end, but the floor is open if anyone has any follow-up or additional questions to what we talked about today.
Feel free to unmute and ask the questions, or just writing in the chat is also fine. And I can reiterate it. I'll give you a few minutes if there's anything. It's a lot of information, Sarah. Thank you so much.
It's a lot. It's a lot of information.
Yeah, it was wonderful. Okay, so I don't see anything as of right now, but if you're typing, no stress, I will get to it. I will say like we offer these every month, and if there's any topics that we could cover that you feel like would be helpful, please let us know. Okay, so our goal is to bring things to the community that you're looking for. So if there is a topic that you would like to know more about, let us know. Our student therapists are taking a lead on all of this and doing lots of research. And Sarah's done a lot for this. So thank you so much, Sarah. I learned a lot. And I really do think like when in doubt, reach out. So if this spoke to you in any way, like it might be a sign of getting something looked at because we don't have to feel like it's taking away from our life to feel these symptoms. Do you mind just going to the next slide there, Sarah? Maybe one more. Yeah. So this is just a reminder of our next workshop, which is building healthy sleep habits, and that will be with Kelsey. So yeah, feel free. Registration is open, so you can go on and register the same way you did here, or you can also just email and let us know, and we'll register you. And it's every month we offer this. So thank you so much, and we'll be here for any questions that come up. Nothing's come up, so feel free to leave as you need to, or stay and have a conversation. Thank you. I'll hang out just in case there's any questions, but anyone else that wants to, from our team that wants to sign off can, but I'm here. Okay. There's nothing coming through other than some amazing jobs. So I'm going to sign it off now, okay? Because it's just us here.
I'm just sorry, I'm gonna interrupt. Zoom user, they accidentally sent the direct message to me, but they're wondering if there's any tips for a child who has ADHD and gets overwhelmed and starts hyperventilating to calm down. They've tried all the breathing techniques and he just can't get the bear hugs at school. So any other tips for her?
Anything that's coming up, Sarah?
Yeah, so deep breathing and grounding exercises can be really helpful here. So bringing essentially your mind a little bit to the present moment. And distractions can be really helpful, especially with young kids. So maybe this means like Play-Doh, like something to hold in your hands to bring the focus to a different stimulus, and additional grounding exercises. For example, there's a common one where you like to explore different senses. So what are you hearing? What are you feeling? That's why something in your hands could be really helpful. What do you smell right now? Could be helpful in that scenario. But I'll let Kyla take the floor if she has some additional notes there.
No, I think that's great. It's kind of unique as we went through, and all those suggestions you mentioned, Sarah, are great. But I'm even thinking of like all the symptoms, like the way that it presents can be so different uniquely for each child. So like you kind of have to trial and error so many things. Like one thing isn't going to work for every single child in that situation. So brainstorming can be helpful, but getting them engaged with what helps and like checking in on that can be that mindfulness. So like what has helped, what hasn't helped, how is this feeling in your body, and doing some of that can be helpful too. Yeah, we'd be happy to, Zoom user, whoever you are, we'd be happy to connect if you want to reach out individually. We'd be happy to talk about other options kind of specific to your child if that would be helpful. Let us know. Just reach out to the Wellness Within email.
Absolutely. And just to go off of that, I know I talked a little bit about noise canceling headphones with focus. It can also be helpful with feeling overstimulated. So if there's a lot going on around around you, specifically as a young kid, that can be very overwhelming. And not being able to regulate your attention and be like, okay, am I going to focus on this, on this, on this? It's too much. So kind of reducing that stimulation by different ways. If that means, removing from the environment, or noise canceling headphones, or distraction. There's so many different ways to go about that. But that's just another idea. But absolutely, there's opportunity to explore it more through a consult.
I'm just wondering too. Sorry, Kyla, go ahead.
No, I was just gonna say, I feel like there's so many options that I think we could kind of spitball
Yeah.
stuff, but I just think it would be a little bit better to have that like one-on-one, so that you can tell a little bit of what those symptoms are that are surfacing, and how the environment at school, how the environment at home is going, so that a little bit more of a catered approach. So if that person does want to reach out directly to you, Sarah, maybe if you can just put your email in the chat, then they can reach out to you directly, and you guys can chat a little bit more on a one-on-one.
The one last tip that I was maybe just going to share before signing off is, depending on the age of the child too, one that I have seen work in the past, when they have to I liked how Sarah said the grounding techniques. At school, it's a little hard to have teachers all the time. I love that you said he can't get bear hugs all the time. If he can spell his name, something that I think works really well is getting him to look for things around the room to spell out his name just by himself. And that way he doesn't have to rely on a teacher or an EA or anything to help him calm down. If he can do that himself, that's sometimes helpful.
Yeah, that's awesome. Perfect.
That's a great one, Sarah. I really like that.
All right. Thank you guys so much. I am gonna end the meeting now, so we don't keep anyone else. Bye.